run here at CrossFit Bluegrass. What we're going to be talking about a little bit today is about hip flexion. So hip flexion is the movement where your hip pulls up all the way up like this. And we need to look at why is that an important movement for CrossFit. Well, we need hip flexion mostly to have good mobility versus good strength. There's not a lot of things that we do where we really forcefully have to go against weight lifting our legs up this way, but we do have to be able to flex our hips to get down into the bottom of a squat. A lot of things in CrossFit involve squats. We have to be able to get in that position when we row, when we go to jump, when we go to do any type of squat cleans, different movements like that. Squatting is a really important part of CrossFit. We need hip flexion. So if you're having trouble getting in the bottom of the squat, is it hip flexion that's part of the problem, or is it something else? There's a couple of things that we can do to look at and assess. Is hip flexion a mobility restriction for you? And if it is an issue, what do we need to do to make it better? There's really no way to know unless you actually get assessed and looked at for sure what the problem is. The best way to do that is to be a member here at CrossFit Bluegrass. You'll get a chance to come to my mobility classes. I'll take a look at you. We can figure out if your hip is limited in the flexion, and if so, what's going to be the best way to fix that. So one of the things that we look at right off the bat, if people are having trouble getting into this position at the bottom of the squat because of their hips, is can they lay flat on their back and pull their hips all the way up and get that hip into this position here and do that well? Or can they even do that on one leg at a time, where they pull one leg up and it's asymmetrical, one side's different than the other. So there's a couple of things that could be restricting that motion of bending the hip all the way up into flexion. One of the things that could be is the muscles in the back through the glutes and through the butt could be tight, restricting that, or you could get a restriction in the actual hip joint itself. So without getting into a lot of anatomical detail about that, we want to look at what are some of the ways that we can improve the mobility, both through improving the soft tissue back here and the joint mobility itself. So one of the things that I would do with patients at the clinic if I saw a hip joint restriction into flexion is I would do this with my hands, but we can do a lot of really neat things with the CrossFit bands here in the box, would be to get some traction where you get this band worked all the way up into the hip crease and you scoot out to give some pull and work on flexing the hip up so that band is going to be pulling some inferior traction on my femur to help stretch that hip and get a little bit more effective, almost a mobilization with the soft tissue stretch at the same time, so that whether it's the joint itself or the soft tissue that's restricting your mobility, you can kind of address both at the same time. So that would be a good place to start. And then when we look at when we need hip flexion, we're in the squat position here is a little bit more important. So we can also look at getting into some mobilizations with our foot planted in this more functional lunge position, squat position, where we look at bringing our body down to our legs so we can work on improving the hip flexion through this way, with the band giving us a little bit of a backwards or posterior and lateral traction force to help loosen up that hip a little bit more. So that's a nice way to kind of work dynamic stretching in and out. You can work on some lunges, getting yourself into more hip flexion, backing out into extension. Flexion, back out into extension. And then lastly, if you're having trouble still getting into the bottom of the squat, we can adjust the band a little bit, get a little bit of that lateral traction out to the side, and literally let that help mobilize our hip to open up the hip joint while we're squatting, and work through that way to kind of have that functional progression of starting down just with that single knee to chest, working into the lunge position to stretch, and then finishing with the squat press.